What is an HSA, a health savings account? An HSA is designed to be paired with a high deductible health plan. Perhaps you have it offered through an employer, and perhaps the employer will help match some of the contributions. The design of that account is in order to put money away, so then with your high deductible plan, you may have to pay a couple $1,000s, if not more, to be able to then start to get insurance coverage outside of just your regular routine preventative care for it. So by putting money aside into that HSA, that health savings account, it is then helping you plan for the future if something were to change and you had to go to the hospital or go through surgeries, that you can use then that HSA on qualified health expenses. Now, that may be offered through your employer coverage. You may have an HSA available to enroll in. You may also be able to enroll in a separate HSA if you're on a healthcare.gov plan, an Affordable Care Act plan with a high deductible. Why would you want to make those contributions though? Well, an HSA is designed to be able to help with taxes. It's a tax advantage account. So when you put money into an HSA, it works like a traditional IRA. It's your pre-tax money going in there. So you aren't taxed on the money you put into the HSA. You can also invest your money in an HSA if you desire to do so, and then it will grow tax-free. And then when you withdraw it at that time for that qualified medical expense, it then is tax-free as well. So there's a lot of tax advantages to an HSA, and especially perhaps you're someone in good health and you want to go with a cheaper, high-deductible plan, but still have money set aside if worst-case scenario happened. And HSA is a great way to be able to do that. Now, the key to keep in mind is that an HSA is not a flex spending account, an FSA. Those are different laws and regulations. Simply an HSA is a health savings account and has those different tax advantages. Now, if you're on Medicare, you can still use an HSA while on Medicare, but you cannot contribute to an HSA while on Medicare because no longer can you get that tax break with the Medicare program. Overall, if you have an HSA available, it is very well worth it to perhaps enroll, even if you're just putting in a little bit at a time. There are contribution limits. If you aren't even able to max out your HSA, it's still good to at least set some money aside, have it set there, and there's a lot of tax benefits with it as well.